There we go. Yes.
Okay.
Recording is underway.
Okay. Hello, everybody, and welcome to this conversation with UNICEF USA. A hearty welcome to UNICEF USA and to all of you for joining us tonight. I know those of you who are from the West Coast, thank you for putting up with us East Coast types. Well, here we are. I will start by introducing Mansi Mehta, who is the Assistant Director of Global Cause Partnerships. So Mansi and I have been talking almost every 2 months for the last 3 to 4 years. I do know her well, and I did confess to everybody that sometimes we get a little giggly. But here is what Mansi does. In her current role, she works to build partnerships with organizations whose mission and vision align with that of UNICEF and UNICEF USA. Primarily, Mansi manages relationships with women's organizations based in the US and oversees a team focusing on engaging faith-based organizations, professional associations, and like-minded service organizations. Previously, Mansi worked at the Earth Institute of Columbia University on various health and education-related programs with a focus on empowering girls in sub-Saharan Africa through information, communication, and technology. She has a master's in public health and her undergraduate degree are in biology and in policy studies. Welcome, Mansi.
Thank you so much, Veena. It's always a pleasure speaking with all of you, and it's so lovely to see all of your faces. I'm seeing that there's 42 people that are on this call, so hi to everyone, and I really do hope that one day in the near future we're able to all meet in person. So with that, I guess I can just go ahead and start sharing my screen, Wendy. Okay, great, I will do that. All right. Veena, can you see the screen? Can you give me a thumbs up if you can? Okay, got it. All right, so I will get started with our presentation. Again, I just want to say thank you so much for this opportunity. It's always such a pleasure, and really it's a joy. As Veena said, her and I have been working together for the past 4 years, and it's almost as if instantaneously we just had this connection, and it feels so good to feel like I'm talking to someone that I've known for many, many years. And that's just the vibe that I've always gotten from all of the members that I've met at Dining Forum. And so really thank you for this opportunity. And I really look forward to, like I said, meeting you all one day soon. UNICEF USA has been incredibly grateful to Dining Forum for your continued support over the past few years. And our partnership really began back in 2017 with support to empowering Syrian refugee women, to then working to support women and girls in war-torn South Sudan, preventing gender-based violence. Then from there, Dining for Women decided to support UNICEF around maternal child health care and the Rohingya refugee crisis. And so as you all may be aware and may be following quite well, because of COVID-19, rates of gender inequality have continued to be on the rise. So now more than ever before, women and girls around the world need our support. So really, I think Veena was saying before we started the presentation that, you know, the fight goes on. It doesn't just stop here. And actually the situation is much, much worse now because of COVID. And so really, I think, you know, this is an opportunity for us to think and really put some thought into what is it that we can do together as a global community? How can we continue to synergize our efforts in support of women and girls globally and also here domestically? So before we dive into the rest of the presentation, I do have two wonderful colleagues here with me this evening, and I'd like to turn it over to Alicia and Andres to introduce themselves. Over to you.
Okay, thank you, Mansi. I'll go first since you said me first. Hi, everybody. My name is Alicia Godsberg. I work at UNICEF USA on the Global Programs team. I'm Assistant Director. I've been with the organization for about 4 years. Actually, it'll be 4 years in just a few days. And I work on the WASH portfolio, the climate energy and environment, gender, and I was working on the health portfolio, and I worked on this proposal with Mansi for you, which is why I'll be speaking with you about the program today. So it's great to be here. Thanks for having us, and over to Andres.
Thank you, Alicia. Hi, everybody. My name is Andres Kragelund. I am the Assistant Director of Humanitarian Response for Unicef USA. Basically, what that means is whenever there's a sudden onset emergency or something happens in a protracted emergency, such as in Bangladesh, I help the organization coordinate efforts to ensure that we are able to get the message out there, fundraise, things like that. I've been in the organization for over 4 years now. And it's a great pleasure to be here with you all. I look forward to speaking more with you all, and yeah, pass it over back to Mansi.
Thank you both. All right, with that, we will continue. So the agenda that the three of us have in mind is really to start first with the basics. Who and what is UNICEF? What is the history behind UNICEF and our name? Then I'll jump into differentiating between UNICEF and UNICEF USA, which is what Alicia, Andres, and I work for. We work for UNICEF USA. And then I will turn it over to Andres and Alicia to talk about the unfolding of the Rohingya crisis. And then it will come back to me to talk about Dining for Women, your support and your role. We'll also touch on UNICEF and advocacy and how UNICEF specifically works with the government at the country level, works with the local NGOs, works with faith-based leaders and women's organizations on the ground to mobilize implementation of programs. And then we'll end the presentation just briefly talking about the power of partnership and how partnership really is the way that we can continue to have impact on the ground and increase that impact for women and girls around the world. And then of course, we'll have some time for question and answer. All right, so to start, I think you can see on this slide very clearly, but I'll give a little bit of context as to what the history and the mission of UNICEF really is. So it was founded in 1946, and really the reason why UNICEF was founded was to help war-torn children post-World War II. So children in Europe and in China. And really it was founded because the United Nations came together and they said, wait a minute, we don't have an organization within the UN system that is here to support just children. So initially when UNICEF was founded, it was founded for the purpose of serving children during an emergency context. And then in 1950, UNICEF's mandate was then broadened to really address the long-term needs of children. So children and women in developing countries. So not just looking at children during an emergency context, but looking at a child holistically. How can we ensure that a child is not only surviving, but is also thriving through their childhood into their adolescence, and addressing the needs of access to healthcare, access to education, nutrition, child protection, and so on. So that's really where UNICEF's history stems from. And it originally stood for United Nations International Children's Emergency Fund. And now it's just shortened to United Nations Children's Fund. But as you can see, we've still kept the E in the acronym. So today, as I said, UNICEF continues to work in about 190 countries and territories, really doing anything and everything in its power to make sure that we are putting children first, no matter what. A few points that I would like to bring up are that UNICEF is nonpartisan. And as I mentioned earlier, UNICEF does work very closely with the governments to build their capacity to adopt good policies and then also deliver those services for children and their families. And I know that later on in the presentation, Andres will cover this piece of it a bit more, and we'll refer to it as boots and suits, and you'll kind of get an idea as to why we refer to our work as boots and suits. And a few other notes, and I think these are some common misconceptions about UNICEF, is that UNICEF actually does not receive any UN member state dues. It relies completely on voluntary donations from public and private sector donors, including 34 of its national committees, and UNICEF USA is one of those national committees. And as you can see on this slide, UNICEF works in about 190 countries and territories, and there are 3 levels at which UNICEF works. So that's really the country level, then there is the regional level, and we have regional offices in Geneva and Panama, in Amman, in Nairobi, in Dakar, Kathmandu, and Bangkok. And then we also have the headquarters level as well. We do have about 12,000 or so staff. And a point that I would like to make is that within each of our country offices, 75 to 80% of all of our staff are local citizens of their country. And really, that's related to the sustainability piece of UNICEF's work. Our hope is that UNICEF is able to pick up and leave, and the programs and the policies in place will be able to just pick up on their own, because in these country offices, we've been there since the 1940s. We have trusted relationships. We've built really good relationships, not only with the government, but local NGOs, and like I said, faith-based leaders and women's groups. And so the goal really is that by building these relationships, we can leave and the work would just go on without us there. And so it's really helpful to have 75 to 80% of the staff as local citizens of their country. Just a quick few tidbits. We are considered the largest humanitarian warehouse in the world, and we provide vaccines which reach about 45% of the world's children, and we are also the largest water organization in the world. From here, I will briefly just kind of distinguish, what is UNICEF USA? What is our role and what is UNICEF's role? So UNICEF is the global hub for all programmatic work. And we, as UNICEF USA, we are one of the 34 national committees based in developed countries. So there is a UNICEF Canada, there is UNICEF Italy, and really our role is to provide funding support to UNICEF's programs. In addition to funding, we also raise awareness through advocacy. And so we have three main pillars, I would say: funding, fundraising, advocacy, awareness raising, and educating. And our focus is on engaging the American public around the plight of the world's children, women and girls around the world. And the mission is to work really for the survival, protection, and development of children worldwide. And we actually, UNICEF USA is one of the oldest national committees. So we were founded 1 year after UNICEF was founded. So UNICEF was founded in 1946 and we were founded in 1947. This next slide is really just to show you kind of our regional presence. We do have offices across the country, and so I just wanted to take a moment to show you where we're located. And before I hand it over to Andres, I just wanted to kind of just quickly go over, what are the core programmatic focus areas for UNICEF? As you can see on this slide, it's really access to health, nutrition, HIV/AIDS, education, child protection, water sanitation, hygiene, safe and healthy environments for all, and social inclusion. And now across all of those sectors, gender equity and girls empowerment / adolescence and emergency aid cuts across each of those sectors. And so from here, I will turn it over to Andres. Over to you.
Thank you. Thank you, Mansi. Before we begin, I just want to give a quick overview of what I'll be talking about. So I'll give a quick description or situation overview about the Rohingya crisis, provide some examples of UNICEF in action, and also speak about what we're doing in 2020 as it relates, like Mansi said, to our boots and suits, and as well some other key examples of the work that UNICEF is doing. Could you move on to the next slide, Mansi? Thank you. So as we know, 2.5 years ago, the influx began from Myanmar to Bangladesh, and now we're seeing more than 855,000 Rohingya refugees in the Cox's Bazar district of Bangladesh. Right now, the basic needs of the refugee population are being met with support from the international community, but challenges remain. Most importantly, we are still recognizing that there's suffering from acute malnutrition and vaccine-preventable and waterborne diseases. And there's also a wearing down of families' coping mechanisms, which is placing children higher at risk for early marriage, hazardous labor, trafficking, and other negative coping mechanisms. We also recognize, due to the long period of time that this emergency has been happening, there's some impact in tensions between the host community and the Rohingya community. We recognize that this is not just solely because there is a separation, a physical and separation between the communities, but because there's also needs that are unmet in the host communities. For example, the Bangladeshi host community has similar rates of acute malnutrition and child marriage as do the Rohingya counterparts. We also recognize that about 79% of the district's children are attending school at the primary level. This compares to 98% across all of Bangladesh, so there's about a 20% gap there. There's also some equities, some major equities in the response and what's happening on the ground in the camps. Adolescent girls and children and people with disabilities are particularly underserved, so UNICEF is looking at ways to modify WASH infrastructure, so this is water and sanitation infrastructure, for children when they're in schools. They're also looking at innovative ways within the context of camps to make sure that adolescent girls are able to realize their right of education. That could be either by single-sex shifts, meaning that girls alone are able to go to school by themselves, or making sure that there's female volunteers to escort girls between classes. All of this within the context of camps. The situation overview also is focus on health is in the next slide. If you could move on to the next slide, Mansi. Oh, there we go. So health facilities are available in Rohingya camps. I think it's important to recognize that there is, I believe, 37 primary health care centers in the camps that are open 24/7 within the camps. And this is great in the 2.5 years that the camps have been there. But there's also some gaps. The adherence to the minimum standards of services is sometimes missing. Quality newborn care can also be a challenge. And this all impacts complex outbreaks and things like that. For example, last year, only 65% of children received their first dose of the measles vaccines. And then the second dose was only received by 43% of the children. So you see a 20% gap there as well. And part of the challenge is not only providing services, while it still is challenging to get supplies into the camps, there's also a big emphasis of educating folks around the need for vaccines. We surveyed folks in the camps, and about 39% of them were not aware of the benefits of vaccination. So part of the UNICEF's role is to provide those education services. Some others just feared injections and adverse effects to immunization. So we saw that about 13% of folks had those concerns. And lastly, there's also concerns with just whether there's, if they have access to healthcare, how it's managed. We do recognize that there's overcrowding and lack of supplies and equipment. And this is important to recognize as the general context of the camps, not just for the needs prior to COVID, but how these needs are exacerbated in the COVID context. Mansi, if you could move on to the next slide, please. Great. So when we're looking at education, we do have great success when we're looking at education for children between 4 and 14. There has been great progress there, while we recognize that challenges remain. And we also have to recognize that when we look at adolescents being taught in the camps, there are some challenges. And those challenges not only affect adolescents, but they affect specifically girl adolescents. So when we're looking at girls and boys between 12 and 14 years old, when they're trying to access learning and learning centers and go to schools, only 34% of adolescent girls are able to do so, and 54% of adolescent boys are able to do so. The situation gets significantly worse when we look at 15 to 18-year-olds. Only 13% of adolescent boys are able to go to schools, and 2% of adolescent girls are going to schools. So this connects to my first slide when I speak about coping mechanisms, in which sometimes children that have grown a bit older need to leave school to provide for their families and help provide their resources. There's also lack of qualified teachers currently. There's only one primary teacher institute, and it's below capacity. So what does that mean? That there are fewer teachers to fill the vacant positions in the schools. So as a coping mechanism of the educational system on the ground, para teachers, which are not as qualified as students, are incentivized to come in. So while there is somebody still teaching schools, they might not have as much experience to teach children the lessons that they need to learn in school. Mansi, next slide, please. Thank you. So when we're looking at the needs of children on the ground, I also want to keep on focusing on coping mechanisms, just because the recent surveys that came out highlighted how many coping mechanisms there are in the camp. 95% of refugees households have engaged in at least one coping mechanisms, and there's basic ones that the majority of folks focus on. For example, borrowing money. About 68% of those who responded said that they borrow money. Others sell or share food rations, about 35% do. Then when we look at emergency coping mechanisms, which are some that could have more long-term negative impacts for women and children, those are also reported. So we know that some folks withdraw children from school, about 7% reduce expenditures on health and education, 9% sell their labor in advance, and 2% accept a high risk or illegal job. While these may seem smaller and not as much when you think of the big picture, it's also important to recognize that we may be seeing on reduced amount of reporting on this because people might be scared to say that they were taking an illegal job when they're taking the survey. So it's kind of the two things that you have to think about, that we know that for a fact it's a reality because it's reported, but the realities might be bigger than what it's actually reported. I also want to recognize the challenges that women and girls face, especially as it relates to disabilities. The hilly terrain where the camps are very challenging for folks that have disabilities to navigate, especially when it comes to rainy season. So UNICEF is always keeping that into consideration when they're creating pathways between schools and healthcare services, healthcare centers, and areas like that. And then women in general also have challenges in being able to just purchase supplies or foods or whatever it may be. According to the female respondents, 35% of unmarried Rohingya women and 24% of married Rohingya women said that they were nervous or concerned about going to the local market to purchase goods. These concerns are not only when folks leave their house, but also within their house. So about 76% of those who reported gender-based violence reported that it was related to intimate partner violence. So UNICEF is working to make sure that there's these referral linkages and these child protection services and gender-based violence services are well connected to the healthcare centers and education services to make sure that these cases happen less and less. Before I keep on going, I want to show a quick video that speaks more about this in the context of COVID. So I'll let Mansi play that video out.
Sorry, I realized I was muted. Okay, here we go.
Due to this COVID-19 pandemic, there are lots of restrictions in the movement of humanitarian workers in the refugee camps right now to reduce the spread of that virus or the infection. And for that reason, actually, the services has been scaled down. Women and girls also, the same thing, they are locked in, and the intimate partner violence or domestic violence can be also increasing. And what we can do now, only individual case management. This includes the report of violence and abuse, and also the referral services, the psychosocial support. Due to the restrictions in the camp, there are less options for the protection actors to provide those services. Our caseworkers, in some of the times, it's not possible to be in the camps, so they are trying their best to have those services through remote networks.
I think I'll give it back over to you, Andres.
Thank you. I think I was muted. So yes, I just wanted to highlight the work that UNICEF was doing previous to COVID as it relates to child protection linkages. And I appreciate the comment on the chat. Yes, when it relates to physical disabilities, UNICEF is doing work for making sure that there's physical access to services. UNICEF also works by providing psychosocial support to address other types of disabilities. So it is a holistic approach, but I thank you once again for making that distinction between the various types of disabilities. In addition to the work that UNICEF was already doing previous to COVID-19 on child protection, UNICEF also did some great work in 2019 as it relates to health and wash that helps prepare the Rohingya community for COVID. For example, in 2019, the amount of piped chlorinated water increased from 8% to 45% in 3 of the camps, improving water quality and lowering waterborne diseases. And while this was great at that time for ensuring that there's reduced amounts of malnutrition and needing to go to healthcare for any type of sickness that one may have, this was also a great way to ensure that there was infrastructure in place for folks to wash their hands during COVID. UNICEF also carried out a massive multi-sector cholera response in which they treated more than 4,000 acute watery diarrhea patients and vaccinated nearly 700,000 people. This was a crucial part of the work that UNICEF was doing in 2019, and it also helps reduce the exacerbation of needs during the pandemic, because by having these vaccinations up to date, you don't have folks that need to go into healthcare centers while addressing needs that are related to COVID. Next slide, please, Mansi. Great, thank you. As I mentioned before, there's been great work related to school and education for children aged 4 to 14. Almost 220,000 Rohingya children attended school. And it's what we're looking forward to in 2020 is the piloting of the Myanmar curriculum for grades 6 to 9 for 10,000 students. This is a great success because prior to this, for 2.5 years, children that were coming from Myanmar did not have access to their own curriculum that they had previously. And in 2020, they will begin to have access to this curriculum. In addition, I think it's also important to highlight that the first cohort of more than 9,000 adolescents have graduated and are being supported to start businesses and find jobs. So it's not only the education outcomes after related to school, but what adolescents can now do going forward with that. Could we move on to the next slide? So moving forward, what UNICEF is going to be doing in 2020 and is going to be continuing doing is focusing not just on the healthcare services of the Rohingya population, but also ensuring that there's strengthening healthcare systems in host communities. As I mentioned, UNICEF will continue to further emphasize inclusive access and learning opportunities for children with physical disabilities, psychosocial support for children and adolescent girls. And as I mentioned previously, piloting the curriculum for Myanmar. Which this ties to my next slide, which is the boots and suits slide that Mansi had spoken about. When we say boots and suits, it's our way of saying the downstream work and upstream work. Downstream work meaning all the work that we do on the ground, and suits meaning all the advocacy work. As I mentioned, the Myanmar curriculum was a big success because of UNICEF's advocacy in the country. UNICEF also advocated for the resumption of birth registration for host community children. And this is a huge, important, and crucial part of child protection services, because if you don't have a birth registration for the government, you don't have an identification, and therefore you can't access the child protection services that the government provides. Another portion of UNICEF's advocacy in Bangladesh was advocating for government authorities to provide more resilient learning centers. And this is crucial for the sustainable access of education for children. We know that when typhoon season hits, there's a lot of floods. So strengthening these learning centers so that every year folks in the camps don't have to rebuild these learning centers is crucial to ensure that children on the ground are able to every year get there and start learning from the get-go at the beginning of the school year. So I'll pause here and I'll pass it on to my colleague, Alicia, who will speak about the maternal and newborn health program that Timing for Women funded. Thank you.
Thanks, Andres. You know, as you were talking, and I was thinking maybe I would start off with a story, if that's okay, Mansi. I didn't clear this with you, but I'm going to do it anyway.
That's totally okay.
It just came to me. About a year and a half ago, this isn't my story, but it's a story that was told at Unicef USA by a UNICEF, I forget the gentleman's name, but he is a doctor that was in charge of the emergency response in Bangladesh, in Cox's Bazar for the Rohingya population. And he told this story about getting to the camp one day, and I guess you saw in that film some people walking over that path, and this is how the refugees have been arriving. They're walking with everything that they can carry is all they have, or they're coming by boat. And basically, he was saying that when they get there, they're in this, he called it a no man's land. It's not Myanmar and it's not Bangladesh. It's sort of this like zone where everybody waits to get processed to get into the camp. And when he arrived with his team this day, there was a young girl, he said she was maybe 15 or 16, and she was giving birth. And they ran back to their truck to get some blankets and things and to help her. And she gave birth there in this no man's land, and the baby was fine, she was fine, but she immediately started crying. And he said to her, "You're fine, your baby's fine, why are you crying?" And she said that she had been walking for weeks, and her cousin just gave birth a few days before on the road and died, and she thought she was going to die. And that story really stuck with me, and I think it really exemplifies why it's so important to have support from groups like Dining for Women for maternal and newborn health programs, especially for these refugee women. So I want to thank you again on behalf of UNICEF and UNICEF USA for your support for this really important work. And so I'm just going to take you through a little bit the program here that Dining for Women supported. As you can see, basically together we're working to improve the quality of care in 14 primary and 3 secondary health facilities in Cox's Bazar, and train medical staff, community health volunteers, and service providers on quality maternal and newborn care practices. So some of these quality assurance activities include home-based maternal and newborn care, integrated management of childhood illnesses, improved referral services, infection prevention and control, which is really important now in the time of COVID, of course, monitoring and reviewing programs to improve them, and providing incentives to community health volunteers. So next slide, please. And this is just a snapshot of some numbers to show you what was achieved in UNICEF's maternal and newborn health program for Rohingya refugees in 2019. You can see there's a lot of great impact here, but just to give you a little bit behind what these numbers mean. So for example, by counseling more than 42,000 pregnant and lactating women on infant and young child feeding practices, UNICEF is enabling these new mothers to provide the best care for the health and well-being of their newborns. So one of the practices is exclusive breastfeeding for the first 6 months of life. And this substantially lowers an infant's risk of death from diarrhea and pneumonia and supports the development of their immune system. Similarly, providing more than 50,000 adolescent girls and nearly 40,000 pregnant and lactating women with iron and folic acid, UNICEF is helping to prevent anemia, which can be detrimental to the health and nutrition of mothers and babies, and it can increase the risk of other diseases later in life. I think Mansi mentioned that UNICEF provides about 45% of the vaccines to the world's children under 5. So in Cox's Bazar in 2019, UNICEF ensured that nearly 38,000 children aged 0 to 11 months, almost half of whom were girls, received 3 doses of their pentavalent vaccine, which protects them from potentially deadly infections, such as tetanus and hepatitis B. Next slide, please. So the program that Dining for Women supports, it began in January of this year. So we have just some stats from the country office here that show the impact of your gift on the maternal and newborn health program between January and May. Most recently, as we've also heard, we've seen a reduction in the number of essential health service visits because of COVID-19, because of the lockdown and the fear of infection. This has led to a decrease in visits for health services for pregnant women and mothers and newborns. But UNICEF is still doing everything it can to continue providing essential health and life-saving services through the pandemic. And you can see on this slide that there have been some impressive results. For example, during this time through May, UNICEF supported nearly 7,000 antenatal care visits, 430 deliveries, and more than 2,100 postnatal care visits. Next slide, please. So just to focus a little bit on maternal health, UNICEF as a whole supports a network of about 17 public health centers in Cox's Bazar, and they provide basic health care, family planning. They treat infectious diseases such as HIV, AIDS, and tuberculosis, and they treat non-communicable diseases as well, such as hypertension and diabetes. Regarding maternal health, UNICEF works with new mothers to ensure their newborns receive proper immunization at the centers and that they know about and make use of the expanded health services, such as getting their full quota of antenatal checkups, making sure they deliver their babies under proper medical supervision, and giving birth with skilled birth attendants is important because in the crowded camps, the chance that the mother and newborn will survive and be healthy can really be increased if the delivery takes place in a health center or if need be, referred to a local hospital. So we see in this picture a new first-time Rohingya mother. She's holding her newborn and she's practicing something called kangaroo mother care. This is a proven low-cost and highly effective intervention that helps premature and low birth weight babies regulate their body temperature and also encourages breastfeeding. So the baby is held with skin-to-skin contact against the mother or caregiver. And this mother is in the kangaroo care corner of the special care newborn unit at the Sadr Hospital. And we'll talk a little bit more about that in the next slide. So this is a picture of this, it's called the Special Care Neonatal Unit. It's a specialized center that cares for sick or underweight newborns. UNICEF is committed to partnering with the government in Bangladesh to ensure that quality care is provided for sick newborns. And part of that cooperation was creating the special care neonatal unit at the Sadar Hospital. And because of this, hundreds of new lives have been saved. UNICEF also has provided technical assistance to the Ministry of Health and Family Welfare to develop protocols to manage the care of sick and low birth weight newborns and to create standard operating procedures for these units. Before these units existed in the camps, sick newborns had to be cared for in regular pediatric wards, and they didn't have proper quality and safety procedures to help them, which resulted in high fatality rates. So what these special units have that those units don't have are personnel that are specifically trained to deal with sick newborns and equipment like resuscitators, phototherapy units, vital sign monitors, syringe pumps, portable oxygen concentrators, and other essential equipment that pediatric wards generally lack. Next slide. So this is a little bit of information about how the COVID response is happening in Cox's Bazar and how it relates to child health. So as part of the response to COVID-19, all UNICEF supported health facilities now have additional hand washing stations and are conducting triage to identify suspected COVID cases. UNICEF makes sure all health workers have PPE to protect themselves and their patients, and they make certain that patients can practice physical distancing in waiting rooms. They've also built temporary isolation units to hold suspected cases and referred patients. And UNICEF knows that health and nutrition are related, and children who are malnourished have weakened immune systems that leaves them at increased risk for the virus. So you can see here that 11% of Rohingya children under 5 in the camps suffer from acute malnutrition, and these lives are especially vulnerable. In mid-May, the first positive case of coronavirus was identified in the Kuta Palang settlement in Cox's Bazar, along with one positive case in the local host community. And UNICEF and the local health authorities are seriously concerned about the potential impact of spreading the virus in the densely populated camps and host communities, including a concern over whether the health system can cope with an increase in cases. So to help with the response, UNICEF supported the creation of a 210-bed severe acute respiratory infection isolation and treatment unit, providing personal protective equipment to health workers as well. UNICEF's also supporting improvements to hygiene and sanitation to prevent the spread of the virus. 240,000 Rohingya refugees, over half of whom are children, have been provided safe water and soap to prevent infection spread. More than 4,200 communal hand washing stations are now in the camps, and 160 in the host communities, and 9,500 latrines have been disinfected. Next slide, please. So we're going to talk a little bit about COVID-19's impact on women and girls. And I think Andres touched on some of this stuff already, but just to give a little bit more of an overview about the dangerous situations created for women and girls, particularly those who are staying home and are at risk for gender-based violence, or whose education might be interrupted. So UNICEF is committing to ensuring gender equity is at the heart of its response, and has prioritized 5 core programmatic and advocacy actions that recognize public health, social, and economic consequences of the pandemic. So number 1, they're going to provide care for caregivers who are mostly women and also tend to get paid an average of 28% less than their male counterparts, while also being tasked with doing household chores and providing childcare. Number 2, they're going to prepare for increases in gender-based violence by training first responders on how to handle the disclosure of gender-based violence and how to support survivors, especially adolescent girls. Third, they're maintaining core health and education services and health systems, which past epidemics have shown can get interrupted. Fourth, they're engaging women and youth rights networks to support the flow of information through mentors and peer learning, and using digital platforms to make sure that girls and women can participate meaningfully in decision-making processes. And lastly, they're ensuring that data is available on gender and it's analyzed and actionable to improve response. So to help women and girls who are at risk for or are survivors of gender-based violence, trafficking, and child marriage during lockdown, UNICEF is supporting 15 safe spaces in the camps. So I think we saw one of the women in the short movie clip that we saw was a worker at one of these safe spaces. Women can go to the safe spaces for protection services such as group counseling, skills training, literacy sessions, psychosocial support, and case management. And even though they're in a lockdown in the camp, these safe space centers are open and they continue operating, although they have scaled back in certain ways to account for the virus, such as they're minimizing the number of people that can be in each session, et cetera. So in addition to this, female center volunteers and leaders continue to conduct regular socially distant house visits in their communities, sharing information about protective measures to prevent COVID-19, but also at the same time being able to talk about gender-based violence response services and learn how to refer cases of gender-based violence that they're made aware of safely. So safe spaces are going to remain a priority for UNICEF to prevent gender-based violence from emerging as an even bigger crisis. Next slide, please. And I'll pass it back to you, Mansi.
Thanks so much, Alicia. We're almost at the end of our presentation here, and I just really wanted to re-emphasize what was said in the beginning of the presentation, which is really that, you know, pre-COVID, yes, gender equity is and was a huge issue, and it continues to remain an issue. And actually, COVID-19 has exacerbated the great need that women and girls have around the world. And so I wanted to also note the sort of importance of continued partnership as a global community. It really is only when we join forces together that we can continue to achieve more, have greater impact at scale. As you were seeing some of these numbers earlier in the presentation, I mean, these are massive numbers of women and girls that we're able to reach because of partnerships like the one that we have with Dining for Women. And that is one of UNICEF's roles and expertise. It's because of the relationship, because of the connection, because of the trust within the community. You know, UNICEF is able to reach higher numbers of women and girls that are at risk. So I just wanted to say really thank you, Dining for Women members, for your continued interest, for your support. And, you know, I really look forward to continuing these conversations. And we're here for you. And as Vina said, I talk to Vina quite often. So any questions that you might have, you can go through her, you can come to me directly, and I'm happy to answer them. So thank you so much. And I know that we have a question answer session that Vina was preparing. So I will turn it back over to you, Vina.
Okay, so I do have a few questions for the UNICEF panel. Thank you so much for such an informative presentation and giving us all the details of what has been happening in Cox's Bazar. Wendy, we do have some time for both for my questions and for the chat questions, correct?
Sorry, I was muted. Yes, go. Why don't you ask a couple of questions, and then we'll try to get in some of the members. Yeah, thank you.
Absolutely. Okay, so let me start with, in a sense, I think the question that is in all of our heads is, what happens to this community? I don't believe they have an opportunity to go back to Myanmar. There is civil strife again in Rakhine State. And now it's two other groups that are fighting out there, the government and the Buddhists now. So what is the plan for this group? And even if you do not have a specific plan for the Rohingyas, how do you generally negotiate this with a host country?
Andres, do you want to tackle, or Alicia, whichever one you?
I'll say just a couple of quick things, and then maybe Andres can jump on. So in this instance, as you identified, they're not really going to be going back to Myanmar anytime soon, although that is absolutely the hope that the conditions will be ready. Just as somebody that works on water, sanitation, and hygiene in a lot of different contexts with UNICEF, I know, for example, in Cox's Bazar, whereas when the emergency started, they're building emergency latrines and water was being trucked in and things like this to make sure that immediate needs were taken care of. But now as the crisis is protracted, what UNICEF is doing in particular is trying to create more sustainable solutions. So, getting sanitation systems in place, getting water systems in place so trucking doesn't have to happen. So there's waste disposal that's safe and promotes health. It's not a great situation. UNICEF being, as Mansi said, a non-political organization, is a development and a humanitarian agency that helps children. So they're not in the business of trying to negotiate these types of things. Other UN agencies do that sort of thing, but they are working to make sure that solutions are sustainable so that while children are in the camps, that they get the best possible services and their rights are protected and that they are as sustainable as they can be. Andres, did you want to add anything to that?
Sure, I think that's a great summary. I'll just add some small points. There was an attempt in August 2019 by the government of Bangladesh to encourage a voluntary repatriation. No refugees decided to do that. So there has been an attempt, and we know that refugees themselves don't feel comfortable going back to Myanmar given the concerns regarding violence. On the flip side of that, the government of Bangladesh, while having these camps in their land, there has been some tensions. For example, when the second year anniversary, I hate to call it anniversary, but the second year mark came about, there was a peaceful protest of about 100,000 people, and UNICEF reported that the government had cut off 3G and 4G internet access during that. So I think from both sides of the government, the refugees populations kind of feel stranded in the no man's land that Alicia mentioned. So unfortunately, the answer that we have right now is that there's no feasible, durable solution at the times. So what matters right now while that is being underway is what Alicia mentioned, building infrastructures to ensure that children and women and families have the services they need while governments address these needs. Usually when UNICEF does negotiations is to enter an area that is controlled. For example, in Afghanistan, they'll be Taliban controlled and they'll enter to provide services rather than negotiating repatriation. So that would be another UN agency, which UNICEF, of course, works hand in hand when addressing emergency needs. Over.
Absolutely. So this is a question that is more directed, in a sense, philosophically, and this is more about prevention. I know you said that UNICEF, the UNICEF family is nonpartisan, and you're not in the business of doing the political negotiations all the time, except if it is for care. But we're looking around the world and you see bad state actors who are using hate and ethnic strife, and they're causing populations to disrupt their lives, run away and move away to some other location, and creating a humanitarian crisis that the rest of the world is having to deal with, whether it's UNICEF or other organizations or other countries. But the state actors are getting away scot-free. So it's almost like they know that if they have hate, all they have to do is leash violence and out all these people leave. Is there any way the world community can kind of make this not happen? I mean, we have the refugees in South Sudan, the ones in Jordan, the ones in Bangladesh, all of whom the Uniting for Women has supported. Do you even have an answer to the question? If you don't, we can move on to the other questions, but I thought I'd put it out there.
I was thinking when you were talking about that, I was thinking about the crisis at the US border as well, with the children coming from Honduras and Guatemala and El Salvador, and you know how sad it is. But I don't think there's really an answer, unfortunately. But UNICEF does try to address root causes of the reasons why people and families have to migrate, whether that's climate related or resource related. I think that's maybe the best you can say, is that by addressing root causes, perhaps, I mean, if you take evil human nature out of the equation, but just to the things that can be addressed, you know, UNICEF definitely works on those things. Over.
Absolutely.
Yeah, I think, you know, I'll add to that too. I think, Alicia, you hit the nail right on the head. Unfortunately, the bad actors will always be there. And I think as a global community, it really is our job to continue fighting the good fight, you know, whether that's here from our homes in the States, or whether that's as a field worker for UNICEF or any NGO or any organization really for that matter. But to continue fighting the good fight in the sense that, you know, when we are able to, and this goes back to the slide that Andres was talking about boots and suits, when you know, our staff on the ground, our UNICEF staff, are able to put the suits on and go talk to government officials, to, you know, walk through muddy terrain waters and try to have conversation with rebel groups to say, hey, we're here because we know you have children and we want to help your children. So, you know, having those kinds of peacekeeping conversations and trying to have ceasefires and trying, I think, is the key word. And I think as a global community, that's all we can keep doing.
Mm-hmm. Given the mood in the United States as well as around the world, where the youth of our countries are not going to stand for this kind of hate and business as usual kind of thing, can you expand on some of your disaster risk reduction projects and even your climate change projects? Because this is the long term and the youth are thinking about their futures. So can you talk about that before we go to some other questions from our members?
Yeah, I can talk a little bit about that. Climate change and disaster risk reduction is an area that UNICEF is a little bit late to the game on, but recognizing that in the past, I'd say 2.5 years, has really put a concerted effort into building a global strategy and framework on how they're going to become a bigger player and as the value add, as the voice of children in that space. So disaster risk reduction is one strategy that UNICEF uses to approach preemptively identifying and assessing and reducing risks so that communities can recover more quickly from shocks and more importantly from repeated shocks. So UNICEF takes this child-centered approach, which means that in the aftermath of a disaster, schools are going to be safe and education can continue even while the communities are being rebuilt, and children have the right to participate and access information, and infrastructure is safe. One of the things that UNICEF does really well is called Build Back Better. So after a disaster strikes, they kind of, they make sure that whatever infrastructure is being rebuilt, whether it's a hospital or a school, that it's built more resilient to future shocks than before, whether that's hurricane proofing or moving something to higher ground or whatever it is. And I'll just say a couple of words about the climate policy and strategy, because it's been really great. This is one area that I work on, and it started out as like a part of the WASH program, and now it's its own, has a life of its own. So it's really exciting to see it come to life. So the strategy is anchored around 4 pillars, and they form the basis for advocacy and program interventions. And for each one, UNICEF has kind of a call to action for governments to do, and then an internally focused, what are we going to do about it kind of focus, which is, I think, really great and smart. The first one is make children a focus of environmental strategies. The second is empower children as agents of change. The third is to protect children from the impacts of climate change. And the fourth is to reduce emissions and pollution. So for example, the Haiti country office is run 100% on solar power, and more UNICEF country offices are doing this. And just to let you know, there's 4 program focal points that the program is the Climate, Energy, and Environment program is going to work through. And that's through climate smart health centers and climate smart schools, So making sure there's solar power and other renewable sources of energy there. Reducing exposure to pollution from air, soil, and water, and providing climate resilient wash services. So that's a commitment UNICEF has made for all of its water, sanitation, and hygiene services from here on out. They're all going to be resilient to climate risks. And that's throughout all programmatic interventions.
Absolutely wonderful. I just wanted to remind Dining for Women members that if there's any organization that's focused on youth, it is UNICEF. UNICEF has invited Dining for Women to participate in their youth summit, and it is a sea of young people. It is extremely inspiring to see. The summit is entirely controlled by them. They run the whole show. And of course, they're marching to the halls of Congress to advocate for their own futures. Dining for Women has had a youth delegation that actually presented at this summit, and several of us who are on this call have also been there. So I'm going to stop there with some of my questions, and I'm going to let Wendy read out some of the specific questions from our members in the chat.
Thanks, Veena. First question we've had several times is about the slides and whether they can be shared. And Mansi already said that she would be happy to send them to Veena and I, and then we will make sure that they get posted on our website. You can find our UNICEF web pages under Learn and then Partnerships. So give us till maybe Monday to make sure we get those up, and they will be available to you. The first question was from Mary Gibson, but I think we've addressed it. It was about how long the refugees are expected to stay in the camp. So I think we'll go on. The next question from Leslie, where does UNICEF stand on increasing immunization rates, especially for measles? And how do you interact with Gavi, the Vaccine Alliance?
You want to take that one, Andres? Or?
Sure. So in regards to the immunization rates, what UNICEF is doing around the world, including in Bangladesh, is if there's going to be immunization rounds, to ensure that there's proper PPE supplies available and there's proper social distancing for folks that are waiting to get these immunization rounds. It's important for there not to be a stop or reduction in these rounds, because then it creates exacerbated problems going forward in the next years. So it's kind of trying to make the balance of having enough supplies to ensure that there's protection from COVID, and also ensuring that there's enough supplies for vaccination programs to continue. And Gavi is a great part of that. We work hand in hand with them to ensure that efforts are coordinated, not just in program implementation, but supplies and market availability as it relates, so we could have a bigger purchasing power to ensure that vaccines are going where they need to be. Over.
Great, thank you. The next question is from Renee, and it is, how are these camps policed?
Well, I think that the camps themselves are run by UNHCR, which is a different UN agency. So they're responsible for the security at the camps. I'm not actually sure how that goes. I don't know if Mansi or Andres, if you know.
I don't know exactly how it's policed, but I think that is something that we can look into and get some more information, and I can share it with Wendy and Veena, unless Andres, you have some further insight.
No, we would have to get back on that.
No problem. Next question is from Lindy, and she is asking, is birth control and abortions available through UNICEF programs in Cox's Bazar?
Well, I know that the UNICEF-supported health centers provide family planning information, which is, UNICEF doesn't really is getting better about speaking about sexual and reproductive health rights, but family planning is kind of UNICEF speak for birth control at this point. They're evolving on that. As far as abortions, I don't actually know. I'd have to ask colleagues on the ground about that. I know that, obviously in a life-saving situation they would, but I don't really know. Andres, do you?
I think that's that was my understanding as well. UNICEF supported healthcare facilities. work to make sure that women's and children's lives are safe, and depending on the situation, if it's great situations, abortions may come about, but we would have to ask folks on the ground more about that.
All right, that is all the questions that were in the chat, but I think we can just take a few minutes, and if anyone would like to mute themselves and ask a question or enter it in the chat in our last few minutes, please go ahead.
While we are waiting on that, I remember when we were having conversations with UNICEF USA before we honed in on this proposal, we talked a lot about so many cultural issues that were coming up with the women crossing over the border and in some ways deeply traumatized and not finding their voices to speak about gender-based violence if they'd experienced it on the way. Some of them, if they were pregnant because of it, were not able to talk about it. And I remember Mansi talking initially about the fear they had of going to the health center so that the whole family would know that this had happened. And so perhaps some of this may be shrouded in all of those cultural issues and the trauma from all of this, which only exacerbates the pain. So any comments about that?
Absolutely. I think that story of the young girl, you know, who thought she was going to die giving birth. And I mean, she was a young girl, and what he was saying by that was that she was a victim of sexual violence, and you know, she was by herself with her cousin, and you heard like many horrible stories about this, but I think hopefully, you know, with the door-to-door, socially distant visits that female community health workers are doing to talk about COVID, where they're also kind of getting in there the information about the safe spaces and the gender-based violence services that are available, providing psychosocial support, and especially for adolescent girls, hopefully that you know, they're open up the doors for more conversation and hopefully helping survivors.
Mm-hmm. So Wendy, are there any more questions? Can I keep going on one or two?
So there is a question from Linda Baxter. Are there other organizations doing similar things in the camps? Any US aid agencies?
Sure, I could take that. Yes, UNICEF definitely has partners on the ground. More than doing similar things, there's a lot of effort done to make sure that it's complementary rather than repeating what one is doing. For example, we work on the nutrition space regarding to acute malnutrition, and then WFP works more so on the food side. So while they're complementary, they're not necessarily one and the same. So there's examples of that. We also, as Alicia mentioned, work with UNHCR to ensure that refugees' rights are met overall, and also our focus on children is also being addressed. So yeah, there's various UN agencies on the ground, as well as other partners are outside of the UN family.
Mm-hmm. Yeah, absolutely.
I would just
know,
add to that, sorry,
Go
real
ahead.
quick, Bina. In addition to the UN agencies, like we had said earlier in the presentation, UNICEF works very closely with the cream of the crop local NGOs on the ground. And there's a very strong vetting process that they go through to ensure that, you know, that they're working and providing resources to the local NGOs that are already doing the great work. So it's as if UNICEF and the local NGOs are really working hand in hand, and they're providing sort of the technical expertise. So instead of other U.S. agencies and other U.S. organizations, I would say it's very locally bred.
Mm-hmm. Absolutely. I was just going to ask if some of our advocacy committee members, I mean, they have been so busy this past week with meetings in the halls of Congress, virtually, of course. Leslie, Chris, do any of you want to make a comment about some of the advocacy work that you have all been doing?
I'm just going to make a shout out for Leslie. I'm going to toot her horn. So she has a great article that came out in the Dish today, you guys, with some really good action steps. And it's been phenomenal. And we've been asking for a lot of money this week, haven't we, Leslie, to go toward women and girls at this point and making sure they're not forgotten. And it's been really empowering and exciting. And yeah, it's good stuff. I actually have a meeting with Representative Pelosi's senior staff tomorrow. So that's going to be something.
And
I'll add that
good luck. Congratulations on that.
That I met this week with the chairman of the House Ways and Means Committee, Linda Baxter, and I were meeting with him because he happens to be our representative. And we had no idea where he stood on global things because he never did sign-on letters and things. And it turns out he's an avid internationalist, to quote him. And it makes sense now that once I got access to his office, every time I send him something about supporting Gavi or the Global Fund or whatever, he signs on to it. He did say it wasn't all gloom and doom. He's in close contact with Mitch McConnell and with Pelosi for sure. And, you know, he thinks there will be another COVID action, you know what I'm talking about. I've been on things all day. There'll be another replenishment, and he thinks there will be global aid in it this time.
Wonderful.
So.
Absolutely wonderful. Yes, with UNICEF's Army of Youth and all of us out here, I'm sure we can make a huge difference if we just keep going at it. Wendy, you have a few things to discuss?
Sure. I just wanted to, before we leave tonight, I wanted to remind everyone we are holding these national virtual chapter meetings through the end of August, twice a month in July and August. The next one is July 9th, and we will have representatives of both our feature grantee, Restore Hope Liberia. And this is, we have not funded a project in Liberia since 2012. I think that was the only other one. So this will be really exciting to be doing some work in that country. And we will also have a representative from our Sustain Grantee Collateral Repair Project, which works with refugee women in Jordan. So don't miss July 9th. All of our national virtual chapter meetings are listed on the upcoming events page of our website. Go look at the Join Us tab at the top, and then you'll see upcoming events on the sub-tabs. And we have a lot of events there listed there now between our national virtual meetings. Our advocacy chapter meets once a month. The next meeting of that is July 15th. So if you'd like to get involved and join this very active group that is doing this amazing advocacy work, check that out. And we also have our first Big Read, Dining for Women Big Read Book Club meeting on August the 5th. We are all reading The Moment of Lift by Melinda Gates. So if you like to read, join us in that, and check out the book club on Goodreads. Lastly, I just want to say, and this is a special webinar that we held, it's not necessarily our typical chapter meeting, but if you have not made your donation yet this month, please try and do that. Certainly Dining for Women is experiencing the impact of the pandemic, the lack of in-person meetings, and the economic downturn on our donations. The one thing that has been amazing is the increase that we've seen in our recurring donors since this pandemic started. So recurring donor is when you set it up so that every month automatically your contribution will be made to Dining for Women, either through bank draft or credit card. And right now we have a challenge going on. We want to reach 300 new recurring donors by November 1st. And our reward is going to be giving back, which is what Dining for Women does best. We will give a $2,500 mini grant to Gaia Vaccine Foundation in Mali so that they can produce face masks using the storytelling cloth. If you remember that grantee, they used a storytelling cloth to educate women and community members about HIV/AIDS transmission. And so now they've created a new one about COVID-19. And so we have lots of great reasons to get people signed up. We're well on our way. Just this month, we had 98 new recurring donors. If you haven't signed up for that yet, and I know many of you already have, but if you haven't, and please spread the word to your chapter members, because in this time when we're not meeting in person and maybe not top of mind to pop that check out, this is a great way to continue to support Dining for Women, our grantees, and our partnerships like Unicef. So thank you, everyone. Thank you, Vina.
Absolutely.
Thank
Can
you,
we say
UNICEF.
thank you to our UNICEF guests, everyone? You can go to your gallery view.
Yeah.
Thank
Thank
you.
you.
Thank you,
so
guys.
much
Thank you,
for this
Mansi,
opportunity. I hope
Thank
you all
you
have a
all.
lovely
Thank you so
evening.
much.
Alicia, Andreas, thank you so much for being here.
Thank you, Vina.
Okay.
Bye.
All
Good
right,
night.
take care, everyone.
everyone.
Stay safe.
Good night.
Good night.
Thanks, everybody.
Good night.